I'm going to talk about cannabis in medicine, and we're going to talk about how we can use cannabis in medicine. Since there's still a lot of FDA regulations around this plant, which of course for me it's an herbal medicine, and although it's wrapped up in the pharmaceutical industry now, it's wrapped up in politics. It's a very deeply woven thread in our kind of human culture right now, and it's making it harder and harder to kind of see the pure truth about cannabis, the pure human understanding about what cannabis is and how it works. And then of course it keeps getting more complex as we keep playing with it, right? We're genetically modifying it all the time, whether through selection or through actually genetically modifying things. So, for me, the story starts with cannabis as an herb, because that's what it is. And although we can't really talk about cannabis as far as, giving dose recommendations, people sign up for medical cannabis cards in their state. They get, a little license that says you can use cannabis in your state. You get a medical card, and then, you can have a caregiver and provider, but doctors, medical practitioners, providers, they're not giving really clear recommendations about the use of cannabis if it has THC in it. And as we'll see, there's definitely a difference between THC and CBD, and the hemp plant versus the kind of the marijuana plant or the cannabis sativa with THC in it. And that's an interesting element. And so any recommendations I give in here, they're not really coming from me, as a medical provider. I'm not telling you how to treat patients or anything like that. I'm basically using the data that we have out there. And then I'll also share some of my clinical experience with people who have used cannabis and share their experience with me. So the two main endogenous cannabinoids are anandamide and 2-AG. Anandamide is the Sanskrit word for bliss, and it's an endogenous cannabinoid that's associated with us feeling really well. And both of these molecules regulate cellular function by modulating the receptors, right? They interact with the receptors. These are the molecules that the body makes to change homeostatic regulation. Both 2-AG and anandamide act on the CB1 receptor. The principal endogenous ligand for the CB2 receptor is 2-AG. So 2-AG is a big activator of CB2. Again, that's that immune system regulation, right? And CBD raises levels of endogenous cannabinoids through a number of different actions. One of them is inhibiting the enzymatic degradation by this main enzyme called fatty acid amide hydrolase, which basically breaks down the endogenous cannabinoids for them to be recycled, okay? And it also blocks the anandamide reuptake, letting the anandamide be present longer so it can keep doing the job of activating the receptors and causing its downstream action. And when we're evaluating product quality for our patients, we're trying to help people do their own research so they can find the right products. You need to look at the cultivation. Where were the plants cultivated? What parts of the plant were used? What are the suppliers? Do the suppliers meet quality specifications? Are they operating according to GMP standards? Good manufacturing practices. That's important stuff. It takes a lot of work to get GMP certification. It's a heavy duty thing. Lots and lots of very specific actions that can be taken by the company that ensure the quality of the material.